Morning everyone, I'm Dr Manish Tomar and welcome to LifePage. And today I'm going to talk about psychiatry. Before that, just let me introduce myself. As I said, I'm Dr Manish Tomar. I am a consultant psychiatrist currently based in Mandala Clinic. I did my MBBS from Maulana Azad Medical College in Delhi. Subsequent to that, I did my Diploma, which is Diploma in Psychological Medicine from National Institute of Mental Health and Neurosciences, Bangalore. After which I did my MD from the same place, and then I did my completion of specialist training from the United Kingdom. I have been in the field of psychiatry since 1998, and I'm currently practicing as a psychiatrist. It's the study or the science which deals with mental health or mental illness, along with emotional problems and abnormal behaviour. It's not a very old field and it's still developing, and we are still in the process of learning more and more about psychiatry on a day-to-day basis. It deals with both matters of the mind as well as matters of emotions and nerves. And we deal with those problems both with the help of physical treatments like medications and other physical treatments, as well as psychological treatments like therapy and counseling. Basic knowledge about psychopathology when you are studying, even when you are giving your MBBS exams or you're giving your entrance exam for psychiatry, you should have basic knowledge of psychopathology. When I say psychopathology, what I mean is that you need to know what is meant by, for example, hallucinations or delusions, because we need clear terminologies or explanations of what they need to do rather than a layman expression for that. You have to be unbiased. A lot of the time people come to you and they will tell you different stories, and the patient will tell you a different story, and the family will tell you a different story. So you, as much as possible, should be unbiased in understanding what the patient is trying to say rather than making a judgment beforehand. It's a constant learning curve for us. We are always learning something new, almost every single day, whether it is in terms of the cause of the illness or whether it is in terms of treatment of the illness. So it keeps things very positive for us, and it doesn't make you saturate as a doctor or as a clinician. One of the other things that we face as psychiatrists is the lack of resources in India, especially in terms of accessing, for example, psychological services or rehabilitation services. There are places which are available, but there is lack of training in those places, so people actually get more harmed rather than getting better. So that's one of the major challenges in India, especially, is the lack of resources in the government sector and in the private sector both. My usual day as a psychiatrist begins with obviously getting ready and going to the clinic, which usually begins about 10 o'clock in the morning, and I have a few patients in the morning, and which last about lunchtime. Then I have a break in the afternoon, and then again I have clinic in the afternoon lasting till 7 to 8 o'clock. Sometimes I do go out and do awareness programs and teaching programs and things which basically are aimed at improving awareness in the community. As I mentioned before, I usually wind up by around 7 o'clock in the evening, so I do get time for my own family and for my own life practices. It's important as a psychiatrist, especially if you're working in mental health, that you do keep a work-life balance, because it is extremely challenging and can be quite draining as well to see patients on a regular basis, and we do need time for ourselves to make sure that we are well so that we can treat patients well as well. I hope I've given you a balanced overview about psychiatry, and I hope this helps on the long term for you to choose psychiatry. It's an extremely interesting subject, and it's very challenging, keeps you on your toes, and no one is the same, and it's not one glove fits all. So it's an interesting subject. Please do have a look at it if you are interested.